There's one pregnancy symptom almost nobody warns you about, and it's not what you think. Not swelling, not nausea, it's your eyes. And I didn't just read about this, I lived it twice. Hi, I'm Dr. Seymour, a licensed optometrist, and today we're talking about something that doesn't nearly get enough attention. What's happening to your eyes during pregnancy and postpartum. If you've ever felt like your vision was off during pregnancy and wondered if you were imagining it, girl, you weren't. By the end of this video, you'll know exactly what's happening and when it's normal and when to actually call your doctor. So let's start with why. Pregnancy floods your body with hormonal changes, and your eyes are not exempt from that. Estrogen and progesterone affect the shape and thickness of your cornea, the clear front surface of your eye. That also affects fluid retention throughout your entire body, including in and around your eyes. So when people say pregnancy changes everything, they mean it. Y'all, even the parts you never expected. Here's what a lot of pregnant women experience and don't always connect it back to pregnancy. Blurry vision, this is one of the most common ones, and is usually from the corneal swelling I just mentioned. Dry eyes, hormonal shifts, reduced tear production, so that gritty, irritated feeling isn't just your imagination. And for some women, your actual prescription can shift temporarily. Glasses or contacts that felt perfect before might suddenly feel slightly off. And I'll be honest with you, I felt this myself. During both of my pregnancies, there were days I just put in my contacts and felt like something wasn't right. Not blurry exactly, just different. And knowing what I know professionally didn't make it any less strange personally. That's why I wanted to make this video. Because even as the doctor, I needed someone to tell me that this was normal. Now this is important, so I want to be really clear here. Most of these changes are temporary and harmless, but there are some symptoms that need real medical attention, not just reassurance. Sudden vision loss, seeing flashes or light spots that weren't there before, any severe headaches paired with vision changes, and blurry vision combined with swelling in your hands or your face. So these can be signs of preeclampsia or gestational diabetes affecting your eyes, and they need to be evaluated immediately, not waited out. Now, let's talk about postpartum because the story doesn't end at delivery. Many women find that their vision continues to shift for weeks or even months after giving birth. As your hormones slowly recalibrate, this is really important. Many women find that their vision continues to shift for weeks or even months after giving birth. As your hormones slowly recalibrate, this is really important. If your prescription felt different during pregnancy, don't rush to get a new glasses or new contact lens prescription right away. Give your body time to settle first, usually a few months postpartum, before making that change permanent. I've seen patients update their prescription mid-pregnancy, only to need to change it right back after a few months after delivery. So here's my real advice is, if you're pregnant or newly postpartum or noticing changes, 1, don't panic. Most of this is normal and temporary. 2, keep artificial tears on hand if dryness is bothering you. That's simple. A safe fix for most pregnant women. 3, if you're due for an eye exam, let your eye doctor know you're pregnant or postpartum so we can put your symptoms in the right context. 4, the red flags I just mentioned. Don't hesitate to get checked if something seriously doesn't feel right or feels wrong or not just annoying. So back to what I said at the start, this is the pregnancy symptom nobody warns you about, but now you know. If this helped you feel less alone or less confused about what your body is doing right now, that was the whole point of this video. I'll leave some resources linked below, including my own postpartum journal if you're navigating this season and needed somewhere to process it all. Thanks again for being here, and I'll see you in the next one. Just as a disclaimer, this content is for informational and educational purposes only. It does not constitute medical advice and does not establish a doctor-to-patient relationship. Please consult your own eye care provider for personalized medical guidance.